그럼 말해줘 네 마음 바래지고 Baby 같이 올라가자 하늘 위로 All I wanna do is kick it with you 너의 몸에 그린 것만 같은 미소 오늘 일상처럼 네 마음을 see through All I wanna do is kick it with you.
The Ministry of Health Malaysia objective to lead and collaborate to help individuals attain their full health potential and to ensure a high-quality healthcare system that prioritizes people by implementing living properties, professionalism, and individual rights in community involvement. What is COVID-19? COVID-19 is coronavirus disease is an infectious disease caused by the SARS-CoV-2 virus. The COVID-19 outbreak in Malaysia has occurred in two waves. The first wave started 3 cases import from China via Singapore on 24 January 2020, result in just 22 cases by mid-February. The second wave, which began on 27 February 2020, greatly reinforced by transmission at a religious mass gathering in Sri Petaling, Kuala Lumpur, attended by approximately 14,500 Malaysians and 2,000 non-Malaysians. And the first death from COVID-19 in Malaysia was reported on 17 March. The symptoms of COVID-19. The most common symptoms are fever, cough, tiredness, and loss of taste or smell. Secondly, less common symptoms are sore throat, dry hair, a rash on skin, and red or irritated eyes. And the last symptoms is serious symptoms, which are difficulty breathing or shortness of breath, loss of speech or mobility or confusion, and chest pain. What will happen when someone got infected? Will have mild to moderate respiratory symptoms and will get critically unwell and require medical assistance. Chapter 2. Planning. What is planning? Planning is defining organizational goals, establishing a strategy to reach those goals, and developing comprehensive hierarchy of plans to integrate and coordinate activities. Planning will help MOH to know what should be done, what is necessary action to be done, what will be done, how should it be done, and who will do it in order to manage COVID-19 pandemic in Malaysia. The first importance of planning. The importance of planning is to reduce the risk of uncertainty and reduces risk of redundancy. Planning can reduce risk of uncertainty because MOH already well prepared with the uncertainty. With a stable planning, MOH also will reduce redundancy by not wasting any resources. Operational planning is a process of determining the day-to-day activities that are necessary to achieve the long term of the organization. Single-use plan that under operational planning explain about problems and issues that rarely happen. This plan helps MOH to include problem-solving, specific rules, and step-by-step processing in order to manage COVID-19 issues. Tactical plan is micro-oriented and focus your short-term SMART goals, which usually have 1 to 18 months time frames, and it focuses on operations, which includes creating and executing effective, efficient action plans. This means tactical planning will help MOH to focus on the effectiveness and efficiency of the plans. The short-term planning that have been done by Ministry of Health are Movement Control Order (MCO), work from home, and compulsory to wear face masks in public area. And the long-term planning that have been done by the Ministry of Health are social distancing and vaccination.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. I am Khairuzami bin Ahmad Rashidi from class 1H. The chapter that we cover today is organizing. So first thing first, what is organizing? Organizing is the way work is arranged and allocated among members of the organizational. So the goal of organization can be effectively achieved. Other than that, in managing COVID-19 issues, specifically in Malaysia, MOH, or what we call as Ministry of Health, monitor the development through information obtained from the World Health Organization, or we call as WHO. MOH will inform the public about every development obtained from the WHO. Ministry of Health also arranged and allocated all the members of the organization by diving work specifically to make sure everyone can do their job efficiently. The second thing that I will talk is importance of organizing. There is so much thing that the importance of organizing, but today I will cover up just two most important things that related to the MOH in Malaysia. First, distribute workload to all organization members to be able to move towards achieving goals together. This happened to make sure that all members of an organization itself will be giving a specific task. They knew what to do. So they know what to do, what the task that they will do. Second thing is to minimize the cost and to assure that the use of organization resource efficiently. If a great organizing has been conducted, all resources will be used efficiently and not wasting any resources. The last thing that I will cover up today is the organizing strategy done by Ministry of Health. The first thing is work specialization. It is dividing work activities into a separate job task. Secondly, it is span of control. It should be relatively narrow. There must be clear line of authority from the highest and to the lowest level of organization. So there will be levels. Why? Clear line of authority make it easier for organization members to understand to whom they delegate, to who can delegate to them, and when they are accountable. This shows that it is very effective because as we see right now, the COVID-19 issues, daily cases are being declined. That's all from me. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh, and hi, my name is Nur Adlina Batusha and I'm going to present about decision making. Decision making is a process of identifying and selecting a course of action or alternative to solve a specific problem. In this issue, MOH evaluates the alternative and makes a summary from the alternative and come up with the best alternative to manage COVID-19 pandemic.
Generally, there are three conditions in decision making, which are certainty, uncertainty, and risk. The conditions faced by MOH are uncertainty and risk. At first, MOH needs to deal with uncertainty because of the lack of information about COVID-19. MOH also cannot predict the number of cases, and the result of the decision may not even have a possible outcome. But for the latest condition, MOH has information about COVID-19 and came up with some alternative, but the result might be risky. Decision making, which are program decision and non-program decision. However, MOH needs to use non-program decision when COVID-19 happened in Malaysia because COVID-19 is an unusual problem. MOH also came out with a custom-made response when COVID-19 first happened in Malaysia because of the lack of epidemic information. Other than that, there is principle of decision making. The first one is set priorities, where MOH set the work priorities and allocate time according to those priorities. For example, MOH need to decrease the number of cases day by day, treat the infected people, and isolate infected people. MOH knew which work should be prioritized first according to time. Next is acquired relevant information, where there are three specific categories which are basic information that MOH need to have basic information about COVID-19 such as the data and symptom of COVID-19 to provide an essential structure of decision making. Next, elaborating information that is needed to focus on the basic information and evaluate alternatives such as movement control order and vaccination. The last one is performance information where MOH already have the outcome. The last one is proceed methodically and carefully, which means MOH is aware of the possibility and common mistake that will occur during the process of decision making to the employee. So MOH provided a clear explanation of the method so that the mistake can be prevented. Finally, we have decision-making process. There are 4 good steps that will lead to a better decision-making. The first step is MOH investigate the situation, where MOH gathered information about the COVID-19. The second step is MOH develop alternative based on the information gathered from the first step. And the third step is MOH evaluate alternative from the alternative they have list out from the second step. And the last step is MOH implement the alternative and follow up the situation.
Hi everyone, my name is Nurul Izayani binti Abdullah, and today I'm going to discuss about controlling. First of all, what is controlling? Controlling is a management system that employs information to keep track of all the organization processes. The concept of controlling can be defined as a function of making sure that the action of employees of an organization are directed toward the attainment of a common goals and the work is being performed as planned by the management. Moreover, it helps to check errors and replacement corrective action. Controlling strategies done by the Ministry of Health MOH. According to the Director General of the MOH, Dr. Nur Hisham Abdullah, one of the strategies was the placement of thermal scanner. It had been placed all over the stores, restaurants during an event and many more. It is used to check the individual temperature so that the person who has a body temperature that is more than 37.5 Celsius will not be allowed to enter the place. By placing the thermal scanners, the MOH will act much faster on doing swab tests to check either way if the person had a COVID-19 disease or not. Way to enhance the MOH efforts in keeping the spread and mortality under control, a movement control order MCO was implemented on March 18, 2020. The MCO means that the citizens of Malaysia are going to have restriction movement. This step was significant as China had proved by isolating the infected group of individuals and practicing social distancing. The pandemic can be contained. Moreover, an alliance that was established on March 1, 2020 that is involving 38 professional medical societies to support the MOH around the healthcare. The purpose of this solution was to keep the community well informed and to ensure that information made available was true and accurate. Lastly, the controlling strategy is including the updated the country's healthcare infrastructure to ensure that all hospitals and COVID-19 quarantine treatment centers have enough and effective equipment for patients and frontliner workers to use for their jobs. From 526 to 1,034 ventilators, these enhanced facilities cover 89% of critical bed capacity and a 49% increase in available ventilators. Apart from that, all COVID-19 patients, whether symptomatic or asymptomatic, must be hospitalized and quarantined to guarantee that they are closely monitored by healthcare professionals.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Haris Nazmi bin Mia Syamsul Anwar, and I am going to talk about the conclusion from our presentation. Firstly, COVID-19 is a serious problem that MOH should manage. That is because this virus can cause death. Second, if Malaysians follows all of the SOPs and order from the government, it can help to decrease the number of infection day by day. Third, MOH has taken significant actions which are planning, organising, making strategy, controlling to prevent the spread of COVID-19. Last but not least, when everything that have planned went well, it can protect our community from the virus, and the most important thing is it can decrease the number of deaths. That's all for me. Thank you.